Today, I want to talk to you about exercise, and in particular, the role that exercise has in pain relief and wellness. So, what if I told you I had a pill that would provide all of the above that's mentioned on this slide? Reduce body fat, oxygenates the body, wards off viruses, reduce diabetes risk, boosts the immune system, improves mobility and memory and coordination. Would you take it? It sounds too good to be true, right? Well, as you probably guessed, there is no magic pill, but we do have an option that has been shown consistently to do all of these things and more, and it's pretty amazing. So that brings us to what our topic is for today, exercise. Now, I personally love to exercise, and exercise is the foundation for the treatments that we provide in our office. I cannot say enough about the widespread benefits that exercise has on health and well-being. Exercise has consistently shown to be one of the most beneficial ways to not only manage chronic pain, but to prevent and manage chronic illnesses and diseases that plagues our country today. Exercise truly is medicine, and it's as close to a miracle cure or miracle drug that we have, and probably will ever have. And it is the most widely underutilized asset that we as human beings have. Now, Dr. Ronald Davis, once president of the American Medical Association, said, if we had a pill that contained all of the benefits of exercise, such that we just went over in the previous couple of slides, it would be the most prescribed and utilized drug in the world. Exercise is medicine. Chronic illness and disease is a major problem in this country. And as we can see from this slide, over the last 20 years, the chronic illnesses and disease that plague us, partially and mainly due to our lifestyle, will continue to likely get worse over the next 20 years. As we can see, cancer, diabetes, heart disease, mental disorders such as depression, stroke, high blood pressure, they are all on the rise. So the most common chronic conditions and illnesses that plague us are depicted in this slide. Like we said previously, high blood pressure, high cholesterol, arthritis, diabetes, depression, Alzheimer's. 80% of Americans have at least one chronic condition, and 68% have two or more chronic conditions. And these are for adults 65 and older. But the truth is that people even a lot younger are suffering from these chronic conditions. And the research shows they are not just related to our genetics, but they are related to our lifestyle choices. So many of these chronic illnesses and conditions that plague us are preventable and are partially influenced by our diet and lifestyle choices, such as stress management, physical activity, and even sleep. So yes, genetics do play a role, but there's nothing that we could really do to change our genetics, but we can change our lifestyle. And what the research has shown that all these chronic illnesses and conditions that we suffer from, whether it be depression or high blood pressure, all have chronic inflammation as a common denominator. And what the research shows is the underlying driver of chronic inflammation is mainly due to our lifestyle choices, our quality of nutrition, our quality of sleep, our ability and likelihood to manage stress, the amount of physical activity we have, are all drivers of inflammation and thus the illnesses and diseases that we see today. So the top four diseases, kind of what we talked about in the previous slide, are diabetes, chronic lung disease, cancer, and cardiovascular disease. And if we look back to the left here, how it affects this person in the middle, we look at the risk factors. We see tobacco use, alcohol use, cholesterol, high blood pressure, diet, physical inactivity, and obesity. Now, are these things that are genetic, or are these things that we control through our lifestyle choices? I would argue that it's the latter that mainly has influences on the majority of diseases, and that's what the research is showing. We are more inactive now than ever. Most of us sit for hours on end with little room for exercise or activity. Some have even equated sitting to being as detrimental as smoking, or talk about sitting disease. Well, if we look at the graphic on the right here, we show how sitting is linked to inactivity. And actually, there really is not a sitting disease. Sitting isn't bad, but what comes along with sitting is prolonged inactivity. And prolonged inactivity is a risk factor for pain and illness. So, prolonged inactivity is a breeding ground for illness, pain, and disease. So sitting is not necessarily the enemy. The sedentary lifestyle that comes along with sitting is the enemy. So if we look at the average day for most people, we wake up, we get dressed, we sit in our car. Some of us have long commutes, maybe up to an hour. We get out of the car, we walk a little bit, we sit at the desk for 8 hours. At the end of the day, we get back in our car, sit in the car for another hour, we eat dinner, and then we lay around on the couch. And that's repeated day in and day out. There's little variety or variability for movement or opportunity for physical exercise. And the body loves and craves movement, variety, and exercise. So it's not that sitting is bad. Standing all day in one place is just as bad. It's the inactivity that comes with those factors that are the issue. And as we become inactive and sedentary, we tend to eat more calories and burn less calories. So we get a surplus of calories and metabolic abundance. With that comes obesity. And with obesity, we have more risk factors for chronic inflammation, for chronic diseases like diabetes, everything that we talked about. And obesity puts more stress and strain on the joints, which will put you at risk for pain. And obesity is particularly dangerous because the fat around the belly, particularly the omental fat, is actually what's called active fat. It is actively generating inflammation. And it may take time and years for that inflammation to take effect because chronic inflammation is low grade. It's not like the inflammation when you sprain an ankle. And again, as we said, the chronic inflammation is what leads to these diseases like pulmonary disease, diabetes, cardiovascular disease, and so on and so on and so on. So the inactivity drives obesity, which further augments the chronic illnesses and diseases. So as we said before, exercise is as close to a miracle drug that we can actually get. And exercise is truly the best medicine. If we look at the medications that we take, for example, for blood pressure, diabetes, or depression, those pills are targeting the symptoms. So we have to take multiple pills for multiple symptoms, one for cholesterol, one for blood pressure. Exercise has a widespread effect and has the ability to influence all of these things with just one simple lifestyle change. And the best part is there's pretty much no negative or down side effects. And it can actually be very cost effective. So the truth is there's no single pill that could actually mimic exercise. Now medication can be useful and necessary at times, but we should be seeking a more sustainable and safe means to health. And exercise is that vessel. And many times you'll see that when you engage in an active lifestyle with exercise as the forefront and the pinnacle, exercise can actually help you get off of these harmful medications that are responsible for controlling your symptoms. So besides helping to manage chronic illnesses and diseases, like I said earlier in the presentation, exercise is one of the best ways that we have to manage pain, to actually decrease pain and eliminate pain without medication or surgery. Now the brain has an ability to regulate pain by releasing its own morphine-like chemicals, what we call endorphins and enkephalins. Endorphins and enkephalins are our own pain medicine cabinet that we hold within us. And actually, there's been studies that show those endorphins and enkephalins that we can produce are actually more powerful than morphine. So exercise releases our own morphine, and that's why the research has consistently shown it's one of the best ways to manage chronic or almost any kind of musculoskeletal pain. And besides managing pain, exercise in general can give you not only strength because it's going to build the flexibility in your muscles and the endurance in your muscles, but it's going to give you confidence. And the confidence and combined with the endorphins are going to make you feel better, going to put you in a better state of mind. Exercise will actually help to improve the quality of your sleep, and it can positively impact other lifestyle variables like helping you manage stress naturally. And it can even have an impact on your nutrition and your food choices because the likelihood of you exercising and maybe losing weight and feeling better, you may be more conscious of the foods that you are intaking. And in turn, the food choices that you are making will give you the energy you need to sustain exercise. So like I always say, all of the major pillars of health and wellness, which is physical activity, stress management, nutrition, and sleep hygiene, they all can enhance and feed off one another negatively or positively. Exercise definitely feeds positively on nutrition, sleep, and stress. So let's take a closer look of the minimum amount of activity that is required to stay healthy. Now remember that this is the minimum amount of activity, which as we will see is still pretty stringent. And most of us, particularly if you're in pain or have chronic illnesses and diseases, are not getting close to these minimum requirements. So what's required is 150 minutes a week of moderate intensity aerobic activity, or 75 minutes a week of vigorous intensity aerobic activity. So we're defining moderate intense aerobic activity as an exercise that elevates your heart rate and makes you breathe a little faster or harder, but you're still able to sing a song or have a conversation. Now, vigorous intensity aerobic activity increases your heart rate, makes you breathe harder and faster, where you barely can't have a conversation or sing a song, so you're really huffing and puffing. So either 150 minutes or 75 minutes, broken up over, days. You're not going to do 150 minutes in one day. And what is also recommended is 2 days a week of some sort of strength training and or 2 days a week of some sort of balance training. So if you are in pain and you have chronic illnesses and diseases, you want to work towards getting these minimum requirements in. Even if you start somewhere, which we're going to talk about, where do we start with meeting these requirements? So what type of exercises are there? Well, in general, there's 4 main types of groups of exercises. Cardiovascular exercise is what's classically known as running, jogging, swimming, cycling, with not really targeting the muscles per se to increase strength. Strength training is exercise that we would do maybe with, you think of somebody in the gym lifting barbells or dumbbells or CrossFit. They're targeting at strengthening the muscles themselves, making them stronger and more resilient to be able to tolerate more load. And then we have flexibility training, which simply is mainly stretching. There could be static stretching where you're holding a position for 30 seconds or a minute, or there could be dynamic stretching where we're repetitively doing movements, which is more commonly seen as a warm-up for athletics. Some people will use yoga as flexibility training, but as you see, that can overlap with the next group, which is balance training. Now, within balance, you could again be doing yoga for balance, or you could be doing specific balance activities like standing on one leg, walking with one foot in front of the other. But either or, we should pick from these groups and try to incorporate them into the minimum daily requirements of physical activity. So here's a question. Which exercise is best? We know that we have the ability to select from different categories. We know we have different requirements. Is it running? Is it strength training or walking? How about cycling? Which exercise is the best exercise? So the best exercise is the one that you will actually do. So the bottom line is we will never stick to a plan if we don't like it and we don't feel comfortable with it. We want to find something that makes you say, I love to do this. So you have to try to find something that you love or you think you'll love to do. And you have to be consistent with that. We don't want you just to one day per week, every other week, engage in some sort of physical activity, because consistency is the key. Finding something you love is the key. And that's why we recommend working with a professional, whether it's a chiropractor, physical therapist, personal trainer, somebody with some experience in exercise science to help you explore options that may be suitable for you based on your wants, your needs, and your current physical ability. The bottom line is there's something for everyone. And we help our patients find ways to be more fit through exercise. And like I said, it should be customized and individualized to you. Now, if you're watching this presentation and we're talking about exercise and you are in severe pain, you may be wondering, well, I'm in pain, I can't exercise. But if you've been in pain for a long time, you really have to know and understand pain, and you should have a basic understanding of pain or pain science. So that is why we educate our patients extensively on pain, particularly in chronic persistent pain conditions. Because if you strictly only go by pain and let pain be your guide, if you've had chronic pain, you're not going to do much. And the truth is, if you've been in chronic pain, almost everything's going to hurt. That is why you really need the supervision of a trained medical professional to guide you through and to get you on the path of fitness or wellness after an exam, to make sure that your health is cleared to be able to handle any kind of activity, but also to be able to understand where to start with you and what activities or exercise would be best for you. Because we know once you've undergone an exam and all serious causes of pain have been ruled out, we try to educate patients and help them understand you're going to be sore, but it's safe. Hurt does not necessarily equal harm, and there has to be a balance between that you may have to exercise with some pain or through some pain, but not to the point where it's going to cause severe consequences of a flare-up where you can't get out of bed the next day, or you have to take medication to settle the pain down, or even worse, become physically inactive to help the flare-up settle, because then it's totally counterproductive. And that is why it has to be under the guidance of a trained professional. Remember, it's always about safety first. So with exercise, it's all about balance. If we don't do enough, we're not going to be getting the benefits of activity. So sometimes we see with patients, they're kind of just strolling along, or they're only lifting like 1-pound weights. Yes, they are exercising, but it may not be enough to actually get a physical benefit of increasing your heart rate, releasing the good endorphins and enkephalins. At the same time, you don't want to do too much, because again, as I said, that'll cause a flare-up and lead to inactivity. So finding the quote-unquote sweet spot is in the middle of doing too much and doing more than your normal activity, which is your exercise zone to see the benefits of exercise and fitness. And again, to reiterate, that's kind of where you need a professional, if you're not familiar with or have experience with exercise, to kind of put you in that sweet spot where you will be benefiting from the results of exercise. So in our office, once patients have been thoroughly examined, we've gone through an extensive history, and we determine that they are an appropriate candidate for exercise and rehabilitation therapy, we proceed with them based on a stoplight guideline for pain. And that's something that they take with them and implement in their home exercise routine and their daily exercise that they choose. So basically, a red light would be you have pain with it as soon as you start exercise. The pain gets progressively worse. It becomes throbbing and achy as you exercise. You try to push through the routine. When you stop, the pain is still present. It's still present 12 and 24 hours later. You wake up in more pain. And more importantly, it's actually limiting your function the next day. So you could sit less, stand less, bend less. You may have to take anti-inflammatory medication or pain medicine to help you deal. And the flare-up lasts for a while. Now that is totally counterproductive. You may at this point have actually done too much and injured yourself, or may have just caused a bad flare-up, which has further sensitized your nervous system, caused more pain and spasm. Now that is the stage and the area of the traffic light that a lot of patients in pain think of when we talk about exercise. They think they're going to be doing strenuous physical activity that's going to make them worse. And that's not what we want. We want to stay away from red lights And if a patient encounters that on their own, we highly encourage them to call us immediately. Now, a yellow light is where at the beginning of the exercise, even before the exercise, you have pain. But as you do the exercise, let's say as you walk, the pain doesn't get better or worse. Maybe it increases a little bit, but it's tolerable. More importantly, you feel comfortable with the pain. But relatively speaking, maybe it increases 1 or 2 points, but for the most part, not so bad. Then you stop and you still feel the pain. Maybe it's a little worse, but 12 or 24 hours, you feel exactly the same. Relatively speaking, the same amount of pain you started with, or maybe just a little bit increase in pain, what we would call like normal exercise pain. The next day, you don't feel any significant flare up, maybe a little more stiff, but you're not limited any significant way in your function. You could still sit and stand and bend as you did the day before. That is actually what we consider, even though it's a yellow light, that's a pretty successful exercise or rehabilitation session. You were able to move more without any significant flare up. A yellow light is good, but you have to be careful just not to push beyond that into the red zone. And that is where it's very important, as you could see on the slide, to know that, again, the hurt does not mean you're harming yourself. Because, again, if you've been in pain for a while, you are going to feel a little discomfort. You're going to be cognizant of that pain, and it may even increase a little bit. But you're not harming yourself. And then finally, on the bottom, we have the green light, which is the best case scenario that we all hope for. And as time goes on and you get more efficient with the exercise or the activity and your body adjusts to it and adapt, is where you really do want to be, where you have pain before the exercise and then you start the exercises and the pain actually gets better. And the more you do, the better you feel. And 12 hours later and 24 hours later, you actually are noting an improvement in your function. So you're seeing a direct correlation between exercise and less pain. And this whole stoplight is a continuum. So at first, someone may experience a red light, but with some proper education and adjustments of the routine, they're in the yellow light. And then maybe over a couple months, they're in the green light. Or they may just stay bouncing around between yellow and green. Some days feel better than others. But that is where the sweet spot that we talked about, the balance. And that is where you are going to see the beneficial effects of the exercise. So undertaking any new journey can be overwhelming, particularly when you're trying to begin an exercise regimen. But you have to start somewhere. And as this slide says, the journey of 1,000 miles begins with a single step. So the question is, where do you begin? Now, in our office, someone that has had chronic pain, they're not used to working out or exercising, they have multiple comorbidities such as diabetes, obesity, history of stroke, etc. We really do try to emphasize for them just looking for more ways in their daily life to be more active. So here's the suggestions how to be more active, but it doesn't have to be complicated. It doesn't have to be expensive. You don't need fancy equipment. It could be just something as simple as going for a walk on your lunch break. When we talk about the minimum requirements of 150 minutes of moderate exercise per week, that doesn't have to be 30 minutes straight in one day. That could be you wake up, you go for a walk for 5 minutes. And then at lunch you go for a walk for 5 minutes. And then after dinner you go for a walk of 10 minutes. You just got 20 minutes. And again, as we talked about in previous slides, those 20 minutes, if you're consistent, adds up over a week, a month, and a year. Find something you like to do. Go for a bike ride. When you go to the store, park on the last spot and walk to the entrance. Walk up and down every aisle. Be creative, but look for consistent ways to increase your activity and become more physically active. Another suggestion we recommend for our patients is what we call check your step. Now there's many great apps on your iPad or your iPhone or the Apple Watch that actually can track your steps to give you an idea of how much you're moving, to make some sort of consistency for you to monitor. Now what's recommended if we're going to track steps is a minimum, which absolute minimum, 10,000 steps per day. And if you're not already using a pedometer or some sort of app to track your steps, you may see that you're not even close to that, which is problematic. And that alone will give you some motivation to see, I better get moving during the day. So 10,000 steps equates to roughly 5 miles. So again, we're talking about minimums, and the standard for minimum is actually pretty high. Now in our office, the way we further implement exercise for our patients is to use the patient's home exercise program as a starting point. Because again, someone's coming to us in pain, the first thing that we are going to do is try to get some exercise regimen in there. The suggestions that we just made, becoming more active, we make a customized routine for them based on the exam that we undergo with them in the consultation. It's going to involve increasing range of motion, strength, endurance, neuromuscular coordination. But the exercise that we provide can be used as a starting point to begin to increase your activity. So usually we'll send anywhere between 5 or 6 exercises for the patient to be performed daily, sometimes some exercises twice a day. And then as we'll talk about in the next slide, these exercises can also be used as a micro break. And then as we'll see in the next slide, a micro break in and of itself is a means to become more physically active. Normally we use micro breaks as what we tell patients to be their movement pills, which is regular reminders to get up and get out of the position that they have been in for, hours on end. So we recommend usually every 20 or 30 minutes, get up and do something different for 20 or 30 seconds out of the position that you've been in. So for example, if you've been sitting, get up and stretch, walk around. As you can see in this picture, there's somebody doing like chair dips from their office. And then the lady on the bottom here, she's behind her chair doing some squats. But for the purpose of this presentation, we tell patients, if we're as a starting point to engage in regular activity, use the micro breaks as an opportunity to increase their daily fitness and as an opportunity to get some extra exercise in. So if every 20 or 30 minutes you're going behind your chair, you're doing some squats, or you're sitting at the edge of your chair doing some, push-ups with your hands, or going against the wall and doing some push-ups, that is a way to start to increase your daily physical activity. It's a starting point, especially if you're in a lot of pain or you have a lot of chronic illnesses or diseases and you're looking to start somewhere. Begin every 20 or 30 minutes, get up and start moving. If you have stairs or a staircase near where you're sitting, just do some step ups, go up and down the steps. And again, if you're tracking your steps, that's one way to increase your steps. Also, as far as the micro breaks go, you could pick 1 or 2 exercises from the home exercise program that either we have given you, or if you're treating with somebody else, if you're watching this presentation, pick 1 or 2 exercises and incorporate that into your micro break. So every 20, 30 minutes, do 1 exercise from the micro break. 20 or 30 minutes later, get up and do a set of squats. 20 or 30 minutes later, get up and do a lap around the office. And all those things at the end of the day add up. So you'll be benefiting from increasing your daily activity, and your spine and your shoulders will be benefiting because it's taking unnecessary, prolonged, and excess stress and strain off of the neck, back, shoulders, or hips. And I use the analogy, it's like if we stay in one position too long is like having your finger bent backwards for too long. Having your finger bent backwards for hours on end is going to lead to pain just because the tissues are being overstretched and there's lack of blood flow. So the micro break is really twofold. Take the stress and strain off, and it's giving you an opportunity to increase your fitness. So now you have a general understanding of the benefits of exercise and how exercise fits in a comprehensive pain relief program and as a starting point to increase your overall health and wellness. Like everything else, physical activity, again, is just one component of an overall healthy lifestyle. We also have to consider our stress management, we have to consider our nutrition, and we have to consider things like sleep hygiene. And again, we also have to consider the physical demands that we are putting on our body, making sure we're not repetitively using our body in the same directions or sitting in the same prolonged postures. We got to have a lot of variety and variability, and that variety and variability combined with implementing all the other pillars of a healthy lifestyle is what puts you on a true path to wellness.